information, and they will say things like after 6 months, after a year, whatever you have at that point is what you got, basically. And unfortunately, those sort of representations of the path of recovery are just patently false. I would say that to any physician that brought that up to me, anyone really.
Hey everyone, my name is Dr. Nick Halsey with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
If you have any sort of specific questions, I'm happy to dive into those details. I know you mentioned a couple of things about him being kind of 4 years post-stroke. I know that's often a question is it too late? Those types of things.
Yeah, like as I'm kind of diving deeper into it and just trying to, wrap my brain around everything that involves a stroke. That was the biggest question is it too late? Is there a time frame in terms of, therapy, going through these type of robotic, treatments? Have you guys seen people, who have been this far out that have seen some success with your robotic therapy?
It's a good question, Derek. Sorry, I'm just getting a drink of water there. And in terms of this term you're talking about, in terms of time since stroke, I'll often refer to this as chronicity. That's sort of the term that's used clinically. So you may see if you're diving into some of the science, you may see that term, sort of time since stroke equals chronicity. Those are synonymous. Now, when you look at sort of the medical textbooks or these sorts of things, or it's sort of ingrained in a lot of sort of information, and they will say things like after 6 months, after a year, whatever you have at that point is what you got, basically.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro-rehab.
Basically. And unfortunately, those sort of representations of the path of recovery are just patently false. I would say that to any physician that brought that up to me, anyone really, simply because we have mountains of evidence, clinical trials, observational studies, you name it, across years, across geographic regions, across individuals, that have shown time and time again that individuals who are post 1 year can still improve their function. And now their learning rate may change, right? And there's a lot of really nice evidence that says that learning is slightly different after stroke, but that doesn't mean that someone still can't improve their function. And so that is something that's really, really important to mention. This is actually a big soapbox that I will stand on. And I will, until proven otherwise, I will stand on that soapbox until the end of time, because the evidence just says that people who are 4, 5, 10 years post-stroke can still improve. And in fact, when we do look at the evidence specifically, that's the global evidence, just looking at general rehab interventions. When we look at the specific evidence for individuals who are using the Motus Hand and the Motus Foot, those studies, those clinical trials and or large implementation studies have been done almost exclusively in individuals who are greater than 6 months post-stroke. In fact, some of them are in individuals who are probably 5 years plus post-stroke. And so on the scientific side, we have a lot of evidence to support its utility in individuals who have chronic impairments. And in fact, it's of course anecdotal, but the support group is full of individuals who are 10 years post or longer post their injury, and they are seeing improvements. And so I think that's just a high level sort of survey of the scientific data and also of the evidence from individuals using it now. Now, when it comes to some of the specifics, I think it's important to recognize that time since stroke does have an impact. It is not necessarily an outsized impact when it means that, hey, you're not going to improve after X period of time. It just means that over time, there might be diminishing returns, such that someone who is a year post-stroke, or maybe let's say a month post-stroke, is going to have maybe a different ROI or return on investment than someone who may be 10 years post-stroke. So an hour of rehab spent early on might return a different amount of improvement than someone who is 10 years post-stroke. And that's just what the evidence says. So it's not that the improvements go to zero, they just might decrease a little bit, and that's okay. And what that means then is that we may have to dedicate more time to get the same sort of improvement when you're 4 years post-stroke, as in your case.
Thanks for watching this video. If you have questions, or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.